Well, the proof of that, sir, is that it came before this date to show you that there was a discussion. The date stipulated here is 14, but she arrived a week before this date. In no distress, she came, meaning that I spoke with her. Something transpired. I can't prove the call on the card, but the fact that she came a week prior to the date she was given means that something transpired with Luciana. And that date, according to even in my affidavit, I wrote how difficult it was for me to get them to come. Because the husband is a pastor, he said he had church activities. I had to call them by 3 a.m. in the morning and get really angry with them and told them they have to come because they already lost the week. The plan was to do it again and even the 7th. Now, the reason they came on the evening of Sunday is because they still insisted that they had to finish their church activity before coming. I didn't want them to come even on that. The plan was early, but the husband insisted that he had to run the church, living page, and that's when they decided to appear when they wanted to appear.
So they came to the hospital on the 7th or
on the evening of the 7th, Sunday in July 2019.
Is there anywhere where it's documented that they came on the 7th? On the date 7th?
Well, sir, I can only prove that to you by retrospection because she died the next.
The documentation.
Well, the documentation, sir.
When she was admitted on the 8th?
She was admitted on the evening of the 7th and died early in the morning. In the morning of the 8th. So this was an oversight. I accept that.
So there is nowhere that is documented on the date of admission on the 7th?
Well, not direct documentation, but in retrospect, like I said, her death certificate, for example, bears the date of 8th of July. 8th of July, documented. And that's the death certificate with which she was interred on the same day she died. The death certificate was used to inter her on the very day she died, which was the 8th, on the morning of the 8th. And she arrived on the evening of on the eve of that day.
Sorry, I need to see some clarifications. First is that this woman had 4 previous cesarean sections. At what gestational age did she have those cesarean sections? And what were their indications? Were they recurrent or non-recurrent?
Sorry, can you?
The first one is what were the gestational ages at which she had those cesarean sections?
If you look at based on my affidavit, I know them personally. I never did any of them.
No. I'm not asking who did. What were the gestational ages at which cesarean section
was done for her?
Yes.
I don't know because it wasn't in my.
Is it important?
It is important.
Why?
Based on for the same reason, for complications from.
No. I want you to speak like a doctor because
Okay.
you are speaking to doctors on this side.
Okay, sir.
So, what is relevance of gestational age at cesarean section?
Gestational
Your
age.
next decision at CF for another cesarean section. So, for example, if a woman had a cesarean section at 36 weeks,
Yes.
do you think it would be important to consider that gestational age and someone that had cesarean section due to a prolonged obstructed labor?
I'm sorry, but I'm having problems making out.
Well, I don't understand why you don't understand this question.
I try to answer.
Hold on. This woman had 4 cesarean sections.
Yes.
Now, have you heard of a woman who had 10 cesarean sections? Have you heard?
No.
Okay, it happens.
No.
It happens.
I know.
Now, the impression we have from the documentation is that,
Yes.
looking back,
Yes, sir.
how did this woman rupture on your watch?
Okay. In my affidavit, I had already even questioned.
No. Just answer the direct question because we don't want to waste time.
Okay, well.
What do you think is responsible for the rupture?
Well, I think, based on what I see, in my own humble opinion, I see that there were many factors involved. First of all is that Of course, the error of the fact that she has had 4 previous TSs. That's number one. Number two is her age.
What's the age?
45.
So what's the relationship between age and risk of rupture uterus?
There is, well, most of the time, there
There is no relationship. There is
Well-
not saying it authoritatively. There is no relationship between cesarean section, rupture from cesarean section, and risk of rupture next time. So, what are the causes of rupture uterus in a woman who had had previous cesarean section?
Scar breakdown.
How will it happen? That's the question I'm asking.
Well, there are many.
Let me first give you an example. If a woman is contracting,
Yes.
if she's contracting
Yes.
and she has had cesarean section, she has ruptured. That's one.
Okay, I understand what you want now. There are many reasons why she can rupture. That's one. One of them is, of course, onset of contractions prior to intervention. Secondly, if she has excess intrauterine pressure, for example, in a multiple gestation, that can also endanger the scar. It can also be if the placenta, for example, is implanted on the site of previous incision. That can also cause.
It's
Can also
unlikely.
have-
Sorry, it's unlikely. It's unlikely. The first two I agree. The second, the
Oh,
other
yes.
big question I want to ask
Okay.
you is that if a woman ruptures her uterus
Yes.
and she decompensates to the point that she does not have a pulse, will she have symptoms or not?
If she decompensates to the point that
That's because that's what we documented in the case note, that
Yes.
she does not have pulse, she does not have blood pressure. So can a woman have ruptured uterus on the bed and not manifested any symptom?
no. Maybe I documented it there.
No.
What?
I'm talking in the case note that did anybody monitor how she started to deteriorate
Yes.
to the point that you are called?
Oh yes. So what happened is she was asymptomatic. There was no problem, which is exactly why.
You don't get what I'm trying to say.
Okay.
What I'm saying is this: the woman has her tummy is full with baby inside.
Yes.
Then she ruptured.
Yes.
Now she deteriorated to the point that the pulse and the blood pressure are not.
Okay. Let me. I understand what you want.
Now,
What? Okay, sorry.
will there be a symptom?
There will be symptoms.
What will be the symptom?
What she had this particular case, based on our finding, was that she was trying to get up. I don't know where she was going. Trying to get up, and suddenly screamed that she was in serious pain. Now, according to the husband, the pain was very severe because she really screamed out. And then they came to her, and then she
That's
said,
at home.
no, she was on admission.
So is there no nurse?
Yes, let me finish that. So when the pain started, according to them, it kind of they asked her how she was. She said, and she laid back down and she was feeling a little better. They said, but then she kept saying that the pain was there and that it wasn't really going away. Now they didn't really call anybody at first, according to him. They didn't really call anybody at first because they thought that she was not really in any. But then she started complaining a lot and a lot. And that's why they now call the nurse.
Sorry.
Yeah.
So if a woman has, the blood volume in a woman is about 5.6 liters.
I know.
For the blood pressure for the pulse and blood pressure to be unregulable, she must have she will have lost almost all the blood volume.
Yes.
And she will have ejaculate.
Exactly.
Now, did anybody pick her before she got to that level?
I think what I'll do, sir, let me just fill you in on this plan because I think that's the problem here. When this happened, and finally the husband saw that she was deteriorating, he now made down to inform the nurse. And that's when they tried to reach me. That's the plan for the film. So they tried to reach me.
So the nurse did not do anything before trying to reach you? Not even setting up a line, not...
She was, if you look at the case notes, sir, she was already prepped.
Now, by the way, where is the nursing process of this?
I had a problem with it. In fact, we couldn't quite find.
Thank you very
I don't know
much.
what.
Okay.
Thank you. Now, there is a complaint that You never issued, the hospital never issued a death certificate in this case. Is that correct?
Hello?
There is a complaint that she died, she was abandoned, and the hospital never deemed it proper to issue a death certificate.
Yes. So there's such a complaint.
Is that correct?
That's correct.
The hospital did not issue a death certificate in this matter.
Well, we did, but the complaint was that we didn't.
Did you issue a death certificate?
I did. With the husband in my office.
So you issued a death certificate to the hospital?
I did.
What's his name again?
Pastor Eucarius Chukwuke.
Why is he now?
He's no longer, he has been, he's now in another, he's been posted to a different,
He's correct. But now, do you have any evidence to show that the death certificate was actually issued? Yes.
Yes, we do. We have certified true copies.
Certified true copy.
Yeah.
Of same. If you see that certified true copy, will you be able to identify?
I will.
How?
Because I entered it myself.
How will you be able to identify it?
I entered it myself. So the writing will
What are the
correspond.
features? The writing? You said? You said your writing?
Yes, my writing.
And what?
Well, the how do you say now? It's possibly certified.
Just calm down. Just calm down. Don't be calm. Your handwriting and what other features?
My signature.
Your signature. Now, we want to show this witness a certified copy of the death certificate. You have it. Find it one.
Are you presenting the executive or what?
Yes, I intend to present the certificate. Thank you.
We are not.
Mr. Chairman, we humbly apply to take that same as evidence in this case.
The senior, you want to see?
Of course, it came from them, so you should have said it. It came from them.
You want to show it to me, to the doctor?
Let me show it to you, just feel like automatic.
Show it to me before you take you mark it.
This is document. Fine, finally, what is the interval between when your attention was called in this, in her situation and when you arrived at the hospital?
Roughly 45 minutes to an hour. That's what I was trying to explain.
Can you say the time once more? The interval between when your attention was called and when you arrived?
About 45 minutes to an hour.
45 minutes to an hour. And in the entire exercise, where was the husband?
The husband was there, right there at the hospital. In fact, as soon as I was informed, I called the nurse, and then soon after I called him. He was with me on my arrival. He was with me when we were taking the patient to the theater. He was with me in the theater. And he was with me when she died. He was with me when I issued this document. He remained with me while we were waiting for his colleagues, other pastors, to come around. Stay with me throughout, from beginning to the end.
And how did you manage the hospital, the dead body out of the hospital?
Well, they asked that we give them some time, and we of course obliged. Everybody was there while I was commiserating with them. Other pastors made arrangements, and by the time we were sure that they had come to pick up the body, we let them go. That's when I departed.
Thank you, Mr. Chairman. That's all we want.
Thank you. Excuse me.
Yes. Just to start. Okay, thank you, Mr. Chairman. I would like to say that late Mrs. Gibb, you know her very well,
Yes.
and her obsessive history.
Yes.
Good. And you know the risk involved in involved if she were to go into spontaneous labor.
Yes.
Good. Now, you know that if ought not to have gone into labor, having had 4 years previously.
Can I, she never went into labor. I stated that very clearly, and I state it again. She never went into labor. There were no labor reports. She was on distress. There was nothing.
But I was trying to say that she ought not to have gone, if at all she went, correct?
Coming.
She ought not to, you know,
She's
I said
not,
you knew.
Yes, exactly.
Okay.
Which is why we made for us to bring the surgery forward.
And you claim that she went into a sudden abdominal pain, correct?
Exactly.
How do you know that?
By the husband.
Sorry?
By the husband.
By the husband.
Yes.
Now, remember you scheduled an elective CS, correct?
Yes.
And you scheduled 9th August 2019, correct? From the notes.
Yes, I will.
No.
Can I?
No, just, I want to
Fine.
ask you, yes, you scheduled 9/8/2019, correct?
Yes.
And you also told them that when they come to hospital, they should give you a call, correct?
Exactly. That was the agreement.
Good. Yet, you did not take a call.
Not true.
Sorry?
That was a lie by the defendant, and that's what we also contested.
Okay.
Yes.
You know, in paragraph 17 of the affidavit, paragraph 17 of the affidavit of the complainant said
Yes.
her daughter, that is late Kim,
Yes.
kept on calling you,
Yes.
but
That's,
you did not answer their call.
that's what she said. But it's still the same lady who also said we didn't give them a death
Okay,
certificate.
now my question is,
Yeah.
from your affidavit, show us where you counter, because this is an affidavit,
Okay.
where you counter that,
Thank you.
listen to me, that you picked her call.
Okay. That I picked her call.
Yes, those calls that she had been calling you. You said when she arrived at the hospital, she called you. And she kept on calling you. She said she kept on calling you.
Sir, all those are fabrications. She didn't keep on calling me. We were expecting her. I was expecting her. Her bed was ready. The nurses were expecting her. There's no reason why she should come and then suddenly we don't want to see her anymore. We were waiting for the lady. We were practically expecting her. Even before she
I don't
arrived.
want you to applaud this. It's simple. In your affidavit, which is supposed to counter her affidavit, did you state this fact? In the affidavit.
Well,
First report, please.
What?
The tribunal, please.
okay, sorry. I'm not sure that I counted it directly.
Okay, that's fine.
I'm not sure that I counted it directly, but let me, can I have,
But that's all right.
no, I need to show you where. I have to show you something.
Where you counter paragraph 17. I want
Where
you to show me
there was a counter of some sort, yes.
paragraph 17, no. Directly you counter 17 that you have picked up for or whatever.
Council, paragraph 17 of what?
Of our affidavit, of the petition affidavit.
Maybe, that's maybe,
Yes.
that is page 33, is it?
Yes.
So here it goes on,
Hold on. Paragraph 17 is talking about catheter.
No, can I page 2, my class.
it's true of the letter.
In 17, that my late, that's at page 2, that my late daughter kept calling this doctor Lucky, but he did not take calls all through the period we were there.
All right.
That's the affidavit of Mary. I'm a Mary.
All right. Now, in the
Hold on.
Oh, sorry.
The chairman is following.
Yeah, on what page, please?
It is page 2. Page 2. That's an affidavit, page 1, started.
Okay, it's not, I was looking at the father of the,
Yes,
that
sir.
my daughter kept calling this doctor like that. He will not take calls all through the period. You are there. So,
First of all, that was not true because we did exchange communication. And like I said, even before I get into this, these are people who, on any given day when they come to the town, they actually do stay in my house. There's no way she would have gone to the hospital if she hadn't conferred with me. Whenever they come, they go to my house. And from there, we can now do hospital. Just, I can't prove that, but here I wrote here on page 2 of 11, on my counter affidavit.
Yes.
I wrote there in B
Yes.
that I was not in the hospital at the time of their arrival,
Yes.
but in their previous meetings with me, I did agree with the client and her husband, Pastor Ikarius,
Yes.
to call or send me an SMS immediately upon their arrival.
Yes, I said that.
Yes. To enable me to set the process in motion.
Yes.
But meanwhile, there were 2 other doctors in the hospital on duty to attend to her every need, if there had been any.
Oh.
Now, the fact that, I may not have said here that she called and I picked, but the fact that I had already stipulated this, and she arrived and things started, means that they actually got across to me.
Doctor.
Yes.
My question was simple.
Okay.
That you did not directly counter this allegation. In fact, if
Yeah.
you go to paragraph 3K of your affidavit, your 3K, that's at page 7, from page 8, you said that, listen to me, that at 5:45 a.m. on 9 August 2019,
Yeah.
the client was said to have tried putting up to sit down from lying position and then developed a sudden severe and debilitating abdominal pain, following which she deteriorated very quickly over the next 45 minutes. I arrived at the hospital within an hour of the incident after I noticed numerous calls from my night duty nurses and the husband of the client.
You are mixing up the calls.
No.
You are mixing them up. Because the calls you are asking me about now are the calls when they arrive. She said, on their arrival, they placed, read it again. On their arrival, she placed numerous calls to the doctor. The doctor didn't pick. At that time, she had just arrived.
I don't want to waste so much time.
No, I'm sorry. I have to clarify this, sir. I want you are mixing the 2 calls. I'll make it clear now that they were.
Okay, let me just go straight. That you did not directly counter the allegation that the patient kept on calling you didn't answer. Am I right?
This is the counter.
I'm sorry, Mr. Chairman.
So you're mixing it up. I want you to make it has to be clear.
Hold on.
Let me describe it again so that you
The
understand.
man will come in at this point. This is a matter of law.
Let me clarify. I understand the discrepancy. The plan was, the plan was they arrive, call me, and then I'll tell them, okay, fine, get admitted. The call she described that they were calling me, and I wanted to go and check it again. She was talking about when they arrived. I'll read it again. I want to check when they arrived. But when they arrived is not, that was 7 p.m. on Sunday. That is a totally different time.
You have answered my
She
question.
hadn't even undergone, she was still fine.
Okay, doctor.
That's the call she was talking about.
Can you allow me to
And you
ask?
are mixing it up with the first second one.
Can you allow me to ask further questions? Now, while explaining, you said 2 other doctors attended this patient, correct?
No, I didn't say 2 other doctors attended the patient. I said instructions have been put on ground, and if she had any need, is there. If she had any need whatsoever, there were 2 doctors on ground. Again.
Okay, please, from the case note, where did you indicate that you have put even those 2 doctors on ground to check her when she arrives?
That's not something we're going to put on the case note, sir.
Okay, that's fine.
Hello?
Now, okay, what of the doctors? Where did they write? The doctors, the other two doctors, have they indicated or they have they documented?
Submitted their stuff.
They have documented the statement.
I didn't hear you.
Have they documented those two doctors which you said you have arranged for them to see when he arrived?
You're missing the point. I said she had instructions on ground, patients had arrived, everything was instructed, and all she had to do was get admitted and await all the instructions deposited by me on the card. Now, I also said...
Let's be clear.
Okay, sir.
Do you have these doctors based in the hospital before she came for admission?
Yes.
There are two doctors.
Yes, we have two other doctors, Dr. Mewada and Dr. Emmanuel.
And
Now, that also shows you that, well, the calls, he's mixing up the calls.
No.
Not like the calls now.
If the doctors are there,
Yes, sir.
so that when she arrived in the hospital, she'll be attended.
Yes.
This is what we want to do.
We're all aware that she's coming.
What did they do?
There's nothing for them to do based on my instructions. There's no need for them to intervene. The instructions for pre-operation, for pre-op, she had to have a catheter. The nurses will...
Doctor, I want to make a clarification here too. My name is Dr. Ibrahim. Now, when she had that day,
Yes.
previous cesarean section,
Yes.
you have two other doctors within the facility. Why can't they hold on?
Okay.
Why can't they start the process of resuscitation? Knowing fully that it takes you up to an hour to get to the facility. And did they make any effort to resuscitate this patient before you arrived?
Yes, I have to finish that plan too. Usually before we allow our junior most doctor, we usually allow them, they have to stay at the hospital. But recently, as recently as in 2018, we had a meeting and we no longer, because we had a lot of attacks for security reasons. For security reasons, after about 12 midnight, we don't allow, we lock up, the nurses stay inside because we've been attacked several times. So for security reasons, we were even advised by police. The hospital has been attacked 3 times, the doctors have been attacked severally. So we said, okay, no more, because we're being targeted. In fact, practically in the town, I and just 2 other doctors, the ones who have not been personally attacked. So we held a meeting and said, okay, from now on, once it's 12, midnight, something like that, we have a security gate, barricade in the hospital. We lock up and the nurses stay in there, and the doctors will only be called. And that's what we practice. In fact, there are times when we have to send patients away. I have to say this. When emergencies come before, everybody knows me, I'm a hands-on doctor. I can stay up for 3 days. But it became very difficult. There are times when the nurses have called us and said there's an emergency, and we said, okay, look, it's too late and it's dangerous. Send them to the general hospital because, it's not been, there are several times that have been going home and even the police have advised me not to try that anymore. So what we do now is, when the doctors stay late enough, we simply stay on communication level until the hospital necessary come. So they did come, as the protocol says. They called me.
Okay.
No, that's because the... Oh,
Yes, go ahead. Go ahead.
remember, I was asked the question.
Okay.
So my name is Dr. Buba again. In the case of, by the time you came to the hospital, you discovered that this woman had ruptured uterus.
Yes.
And on page 29, if you look at it, you were already given oxytocin to a woman who had ruptured uterus. You are already giving Ometril to a woman who had ruptured uterus.
Sir, I didn't hear
Page
you.
29, please. That will be corrected, but that you have death assessment, complete full thickness, uterine rupture with massive hemophilia.
Yes. I remember.
If you look at the plan, in addition to the IV fluid, you were already giving oxytocin.
No.
Yeah,
I'm sorry, sir.
that's what is written there.
Oh, no, it's a misconstrued. Because if you look at the case notes,
That means the finding.
sorry, I'll clear it for you now. If you look at the case notes, the pre-op order doesn't have oxytocin in it.
May I ask that it not be given to the doctor so that he can make reference?
Yeah, page 11 of the
Case note, please.
of the case note.
That's page 29.
Page 29 of the case. That one.
Look at the case note, page 29. That's exactly what. From page 29, where we are referring.
Page 29, yes.
Yes.
Page 29. Sorry. Page 29 is what I think what is causing confusion here is that there is no dichotomy on time. What I wrote here was a complete summary of what was done during the intervention. During the intervention. And even it doesn't follow line by line how it was done. But if you look at everything, I also want you to see, right below the shutter scene, you didn't notice the adult. Hello?
Sorry.
Yes.
At what point do you know that have rupture uterus? Do you give evidence?
Thank you. That's what I need to explain, sir. Because this makes it look like it was given all together. But I can run it down for you how it was done. When she was in the theater, when it was clear, because what I was doing was, as we were trying to resuscitate her, I was downing, I was struggling.
Did you operate this woman?
No, we didn't touch her.
So at what point did you give oxytocin?
That's what I'm getting to. When we moved her into the theater, and she was now pale. Absolutely, I was preparing because my plan was to go in anyway and try and see what I could do. While I was giving instruction for resuscitation, the husband was there, the nurses were doing what they were doing. I was dressing up and coming and checking and doing what I was doing. Now, when I saw, because my husband called me and told me that I should come over. When I saw that she wasn't picking up at all, and I examined her again, because she never went into labor, there was no bleeding or nothing. Her tummy was ballooned. It was never seen one like that before. The tummy was so big, and she couldn't breathe, nothing. I knew she was bleeding heavily. My plan, I'm coming to it. Let me finish now. My plan was, the reason, hello? Can I continue? Okay. I gave her the oxytocin and the ergot as if I wanted to do a PPH control, knowing that she had a
Excuse me,
Yes.
please, let us, you can hold on here.
Yes.
The woman has a baby inside the uterus. No, just hold on. It's like a balloon. I mean, so that everybody here understands and divides.
Yes.
You have a balloon,
Yes.
there's a content inside, right? And then part of that balloon is torn. Now, hold on. You are giving a drug that will squeeze the uterus and allow bleeding to be more at the point of rest. That's why I ask you. Just hold on. Don't be defensive. Because when you open, it's only when you open up,
Yes.
evacuate the content of the uterus, and repair it back. That's when you can give oxytocin or ergometry. Hold on.
Yes, sir.
And I ask you, did you open up this patient?
No, we didn't touch her.
Now, if you don't open this patient, why did you give ergometry that will make the bleeding worse?
What I did, sir, and why I did it was, when I examined the lady, I saw that I could even ballot, I could practically ballot for the baby. I knew that she was bleeding, and I knew that we couldn't go in quickly enough. So I gave the two drugs, oxytocin and ergometry, for any kind of non-surgical control I could achieve at the time, because that was the utmost intervention we could do at the time before we could do that. I knew that the uterus was bleeding, I knew the baby had been extruded, and there was a bleeding uterus hanging there loose in the peritoneal cavity. So I gave these two drugs not because I was clear that the baby was no longer in the uterus. It was clear from examination that the uterus was empty. The baby was absolutely in the abdominal space. So my plan was, if I could use this for any reason, to at least stimulate some contraction of the uterus to get some constriction to reduce bleeding even before we could intervene. Had it been, it was clear that she was just rupturing. This is not right at all. Okay. But this was done when people practically ballot for the baby. I mean, the baby was there, it was clear. The baby had already been extruded.
Okay, Dr. Thoughts concluding this.
Sorry, sir. Can I just
My name is Dr. Mede Idris. Doctor, just a few questions. How many years are you practicing medicine? Do you have additional qualification? By the standard of that clinic, and the fact that this woman had 4 years,
Yes, sir.
in hindsight, that do you think it was appropriate for you to manage her in that place?
Yes.
Can I make medical sense?
Yes, she's not, she's not the first. I mean, we do a lot of, she's not.
No, we're talking of 4 previous years.
4 previous.
5-year-old lady.
Yes.
Yes.
Well, sir, this will come in retrospect because it will look like she wasn't proper. But she's not, we've done many 4 previous years. I mean, she's not the first person, and we've never had a complication. Never had one complication. And if you look into the case notes and the story behind it, you'll see that we are well aware of the things that can happen. We are well aware that this can happen. This is why, in retrospect now, I fought a lot with them. They were difficult. I was the one calling and pulling them to come. They wouldn't come. I mean, they were, you know how patients can be.
So,
I had to put
the
pressure on them because I knew what was happening. In fact, yes.
Do you think your personal relationship with this patient
Yes.
caused themselves on you?
No.
Or
In
you-
fact, my personal relationship with them is the reason I don't call any patient by 3 a.m. in the morning. My personal relationship with them is the reason why I couldn't even bring her to come to the hospital. Because they were so lackadaisical about it. Everything was really,
Thank you.
Yes, sir.
I just have two questions to ask you. Doctor,
Yes, sir.
it is the responsibility of the doctor
Yes,
to keep proper documentation and notes of a patient,
Yes.
not the receptionist.
Sorry?
Not that of the receptionist. In the case note, it is the responsibility of a doctor.
Yes, of course. Of course.
Good. Not the receptionist, correct? Not the receptionist. As
No,
you said.
no, not the receptionist, sorry.
Now, you have just tendered certificate of death, right? The
Yes.
last document tendered. Now, you did not document the issuance, nor do you actually, or did you actually even certify the patient dead by the records. In the record, in the case note, you did not indicate issuance of this exhibit you have tendered, nor did you even certify the patient dead from the record. From the case note, yes. Case note, look at the case note.
I wrote here, patient suddenly stopped breathing. All efforts at resuscitation failed. Husband's request to have baby surgically delivered after the mother's death rejected. And explanations given with proper counseling. Bereavement counseling done.
Is that how a patient is certified?
Well,
dead?
the only thing not written here is patient certified death.
Good.
You need to
Now,
know.
my last question.
Yes.
Precisely, when did this patient die?
Yes.
When did she die?
I know.
Precisely.
Well, let's be real.
No.
If I just let me finish. Sir.
So, no, doctor, you should answer my question.
Okay.
This is very simple.
I can give you a range because we're all traumatized. Nobody can pretend.
When you have a certificate of death, when did the patient die?
Well, she died between 8 and 8:15.
Okay.
I can't lie because she didn't die. Let me finish. You can't tell me that she died and I started checking the time.
Which
That's the reality.
which date?
Sir,
Which date?
of 8th of July,
Which year?
2019.
Now, from the record, show us. From the record.
From the record?
Yes, that case note.
Okay.
And in the affidavit. From the case note first.
Yes, I'm going to tell you why I did what I did. That's important. I even had to discuss with my attorney because the affidavit, this is very importantly, her affidavit was full of errors. And anytime we correct the errors, they adopt it and correct it. And then we ask ourselves, why should we keep telling them what they did wrong? She got my name wrong. She got everything wrong. She got the number of CSs. She doesn't even know the number of CSs her daughter had had. She made all kinds of ridiculous assertions So we stopped correcting and followed her date.
Doctor, when I ask you question,
Yes.
answer me, you keep on going.
No, I'm just telling you,
The
because,
question is simple, please, so I can sit down.
please come again.
That from that case note, which is a document for this court,
Yes.
and the affidavit, show us exactly when this patient died.
Okay. From the affidavit, we followed her petition deliberately. On the case note, it is 8th of July. If we had told her what the date was, they would simply correct it and tell us. That's what they were doing.
No, answer me from the case note. Now, case note.
From the case note,
Yes.
the date on the case note is 8th of the last date entered. Let me correct it. Let me come again. The last date
of death.
Date of death
From the case note.
No. Date of death for the case note, only the time is indicated. But
So you don't have it, it's not there.
So, Doctor,
well,
Doctor, just listen.
okay.
If you look at page 35, where we talk about all,
25 for the case note, sir.
yes, schedules, why you have all these 45, is it the same date?
Let me explain this to you. Let me explain that.
Listen to my question.
Page 25. I don't know which one of it is.
Page 25
Of the affidavit.
of your case note. Why is the record? The date is 8th of July, 2019. Why you have this 45-year-old?
Yes, exactly.
Is it related
That-
to that page 31, where you have the time 8:15?
Yes, exactly.
Continuous.
Yes.
Are they continuous?
Sir?
Is it continuous?
No, it's less than 24 hours later.
So the date, the time 8:15 is not on the date of 8th of July.
The 8th is the 8th of July. She arrived 7 p.m. Let me make it clear. She arrived 7 p.m. on Sunday, 7th of July.
So just
And died
if it is
around-
correct, just own it. He's asking you on the date. If it is continuous, just say this is the date and this is the time.
Okay.
I don't know why it is difficult to answer it.
Okay. It's coming again, sorry.
I said from the record,
Yes.
this confirms to us
The date,
yeah.
8th of July, 2019.
Okay, that was for this.
Thank you very much.
I'm Dr. Ola. I just want to ask you, Doctor, that did you at any time invite a specialist, knowing you are not a specialist, to attend to this patient, knowing her obstetric history, or in your hospital, you attend to all patients,
No.
able to manage?
No, we don't. We actually do invite. In fact,
For this case, did you invite?
ma'am,
For this case, did you invite a specialist?
no, not
In
directly, no.
history.
No, not on this case.
I'm Dr. Boremi. My question is that, is it appropriate that because of armed robbery attack,
Yes.
you tell your doctors to stay away from the hospital
No.
and leave only the nurses, and most especially when you have such a critical case? And then how do the armed robbers know the difference between a doctor and a nurse, when we know fully well that a nurse can be a male or a female and a doctor can be a male or a female, and they do not necessarily have to wear uniform? Thank you.
Let me tell you where we are is Pontoise. Hello? Sorry. Can I continue? Can I continue? Okay. We're in Pontoise. Everybody, and if the sorry, hello. If according to what you were saying, which is not untrue, that it will be, but that will be in the city. Where we are, we're well known, and if it was what we're saying, the nurses would have been the ones being attacked all the time in the town. No nurse, I'm saying it now, no nurse has been kidnapped, no nurse has been attacked, and I'm not talking about armed robbers, I'm talking about robbers, kidnappers, whatever. All the ones. It's every day we have kidnaps. I've been warned severally. They even told me what they said they will charge if they catch me. We have it going on every time. I'm just telling you, even the police, sometimes when I have to do a search in the night, I have to call the police. My car is the only one standing on the entire road at 3 o'clock in the morning. I have to call the police and pay them with my money just to be a little safe. Most of the time. It's not that we're not joking. In fact, Dr. Mewa, the director of the hospital, has been attacked twice. He has been attacked twice. He almost lost his eyes. After that, we knew the other doctor, Dr. Ali, was attacked. They broke open his skull. The other doctor, Dr. Ima, they attacked him too. I tell you, there are only about 2 or 3 doctors who haven't had direct attacks. It was serious. In fact, the area commander had to call us and sit down with us as doctors and tell us, some things we need to do. It was that serious, and it's still there till now. I don't want to sound sentimental, but I've been followed to my house 3 times. When I leave the hospital, they follow me, and I have to go past my house. If you ask, I think, if you want to know the general temperature, just call somebody from 2 hours and say, how is the place? It's not nice. And even the surroundings are not nice. We are part of the people who were, one of the reasons we came late last time is because we were under curfew. They blockaded our network, blockaded everything, because it's a horrible environment. Everywhere around is very unsafe. So the orders, in fact, the director himself had to start warning me, because I didn't listen a lot. When you call me, I come up. When you call me, I come up. And then he started warning me that anything that will be left should be left, because I mean, it's been bad. Very, very bad.
Okay, doctor.
Yes.
So, when we go on, when we get written addresses.
Thank you. This is the case for the defense. Everyone applied for a quick adoption of written and closing addresses.
When will you be able to serve us with your address? When will your address be ready? Tomorrow, next tomorrow, when will you be ready?
That will be needing at least a week.
A week, what?
Can't you make it tomorrow?
It's okay. I will try for next tomorrow. Okay. Next tomorrow. I don't live here in Abuja, so that I can find a certain place.
So tomorrow, you want to make a case? This case has been on for a long time. You want to make a case?
It has, but it also has to be concluded.
Don't you make your client?
I'm sorry, sir. Assuming I have a friend here, it's easy for me to return back to the office and do the job. I have to look for a place now where I can stay to do it. I don't want to like here in Abuja.
So you can do it tomorrow?
I will do it tomorrow.
Okay.
Okay, and when you start with tomorrow, I can be able to start you with my own next tomorrow, so that we can adopt it if possible next tomorrow. Is that all right?
Okay.
Thank you.
Dr. Ume Musa, can you please stand down? The Disciplinary Tribunal, we have to go on the recess now.